Tuberculosis, TB, is an infectious airborne disease that includes symptoms such as a prolonged cough for more than 2 weeks, night sweats, fever, weight loss, and chest pains. TB most commonly attacks the lungs and is spread through air droplets, which are expelled when persons with infectious TB cough, sneeze, speak, or sing. Those most at risk for TB include residents and employees of high-risk congregate settings, healthcare workers who serve high-risk clients, medically underserved, low-income populations, and children exposed to adults in high-risk categories. What are the risk factors for tuberculosis?
There are several risk factors for tuberculosis, but I'll mention a few and the most important. And firstly, I'll talk about HIV. HIV is the strongest known risk factor for TB, and the reason for that is HIV reduces the immunity, so one becomes susceptible to tuberculosis. There are other risk factors, and these risk factors are in fact also related to the fact that the immunity of a person is affected. So to name a few, it's malnutrition or undernutrition is known to be a risk factor for tuberculosis. Diabetes is known to be a risk factor for tuberculosis because it affects the way the immunity functions. Other risk factors that I'll mention are living in overcrowded conditions that increases the risk of somebody being infected with TB. Living in not very well ventilated housing, if there's a TB patient in there, that increases the risk of catching tuberculosis. Infection with TB occurs through only one route, and that's inhaling the germ or breathing in the germ. And the germ is produced by people that have tuberculosis that are not on treatment, when they cough, when they sneeze, or even simply from talking.
We are all at risk of getting TB.
But it's nice. I'm maningi Mairo. Oh, Manza.
To become infected, a person has to come in close contact with another person having active tuberculosis. In other words, the person has to breathe the same air in which the person with active TB coughs or sneezes.
So now let me just rush. I'll come my meetings when more.
Diagnosis of tuberculosis includes a medical history, a physical examination, and collection and analysis of sputum samples. A patient coughs up a sputum sample, which is then sent to the laboratory for analysis.
The diagnosis of TB, the main way that TB is diagnosed is through examination of a sputum sample that is produced by a person that is suspected to have tuberculosis. But of course, there's also a history taking. The clinician that is seeing that person has to take a history. There's also an examination of the patient. But after that, a sputum sample is usually requested for if TB of the lungs is suspected. However, sometimes a chest x-ray as well is used, especially if the sputum doesn't yield any result.
4 drugs are used to treat TB: isoniazid, rifampicin, ethambutol, and pyrazinamide. Sometimes a 5th drug is used when it is reoccurring TB in a patient.
The reason for this is to prevent development of resistance. The TB germ is robust and is very difficult to clear from the body. All the drugs kill the TB germ, but they act in different ways. So some drugs kill it immediately. Some drugs slow down the growth of the germ. Therefore, you don't have the germ multiplying, and then the germs get old and get depleted. And so several drugs are used for that reason, to try and clear the germ very quickly from the body to reduce the risk of it developing resistance.
TB will not spread fast if it's diagnosed and treated quickly.
TB drugs have to be taken regularly, typically for 6 months. Many patients abandon their treatment when they feel better. Similarly, preventive treatment is often abandoned because of the inconvenience.
Baby, I already told you. What is the point of me taking this medication when I'm feeling much better? Now I'm feeling much better. There's no need for me.
6 months.
Asinikana nezo kudwala. But pano nimvera ko bwino. In fact nimvera sabe bwino. Nezo kuswetinga ninasiya. Nezo vera mchifuwa mubaba si mubaba. Mpamvu nezeribu ndonzo tonu gwididira uziba noziba wose uziba nayo. Mozo tonu gwididira. But mpamvu nina zuma mfana ni step one guys nayo.
Mwani mankwala ya for 6 months.
We inesinza mwako. Nganga chiuvuvi fona mankwala bamine kasindoza vima no TV.
Abandoning TB treatment before completing the course simply means that the person is not cured of TB. It takes 6 months, 6 to 8 months to cure TB. So yes, the person may improve and feel better maybe a month or 2 months from starting treatment, and then they stop, and what may happen is that the TB will just recur and then their health will go down.
Drug-resistant tuberculosis is difficult to treat and has a much higher death rate.
Drug-resistant TB is when the TB germ does not respond to the usual drugs that are used for treating TB. And so what it means is if a person has got drug-resistant TB, you have to use what we call second-line drugs, which are very expensive, and the treatment is very long, much longer than when you're treating with first-line drugs.
Directly observed treatment, where healthcare workers watch patients take each dose of medicine, has proved effective in reducing the problem of abandoning treatment.
So at least up a man, second and second month.
TB is curable if you adhere to your treatment.
People can prevent TB by avoiding overcrowding and living in well-ventilated housing. A person suspected of having TB should be referred to a clinic to be diagnosed and put on treatment as soon as possible. TB patients should be encouraged to practice cough hygiene, which involves covering one's mouth with a cloth or tissue when coughing. TB patients are also recommended to wear standard face masks to prevent transmission in healthcare settings. If you live with someone who has active TB, help and encourage the person to follow treatment instructions. For healthcare workers and others that work in facilities that care for TB patients, standard infection control measures must be followed, among them ensuring good ventilation and the use of special face masks. Prevention of TB in HIV-positive people. It is recommended that HIV-positive people should be given isoniazid preventive therapy for 6 to 9 months. TB is curable. In more than 9 out of 10 patients, tuberculosis can be cured with appropriate treatment. Treatment for tuberculosis usually combines several different antibiotic drugs that are given for at least 6 months. No vaccine yet exists that is truly effective against adult forms of the disease. Therefore, it is important to identify the defense mechanisms necessary to protect against tuberculosis infection to make a significant worldwide impact on the disease.